excited to welcome our own Maria Charbonneau, who is a clinical assistant professor for the College of Pharmacy here at Western New England. And she will be talking about diving into the NAPLEX competencies. So without further ado, I'll turn it right over to Maria.
All right, thank you. Welcome, everyone. Thank you for being here. I understand it's being recorded, so for those of you who are tuning in at a later time and date, welcome as well. I'm going to share my screen and show my slides. All right, so if you would just let me know that you're seeing what I'm seeing and that you can see my slides. Okay, perfect. All right, thank you. So I know we have a half hour together, which will go by very quickly. But I wanted to talk about the NAPLEX and the new competencies. The NAPLEX is changing as of this coming May, so May 2025. So I think it's important for us as preceptors to uh, to have a sense of what the new competencies are, so that way we can tailor our rotations to the NAPLEX if we want to. So with that, we'll get started. For objectives, really, I would love for you by the end of this conversation, by the end of this half hour, for you to have a better sense of what the new core competencies are. We'll talk about how to apply case-based learning methods for the NAPLEX and on your rotations to enhance student readiness for the NAPLEX. And we'll also talk through some strategies that you can incorporate on your rotations for those case-based learning. So in order to really jump in and do our objectives, we first need to set the stage and refresh ourselves on what the NAPLEX is. For me, I took the exam going on 7 years ago. There have been some changes since then, and like I said, the NAPLEX continues to change. But at the end of the day, what has not changed is that the NAPLEX is really designed to evaluate general competence. And I highlighted that because there's some debate as to what general competence means. But really what the NAPLEX is saying is that we are testing for entry level. Is it safe for these students, these candidates, these graduates to practice at a general competence level? The NAPLEX is one component of the licensure process. So as I'm sure you remember or may recall, the NAPLEX is the drug exam, but we also have to take a law exam, and the law exam is different, most of the time different depending on the states. So the NAPLEX itself is only one component. And in order to meet the requirements to test for the NAPLEX, you either have to be a graduate of a PharmD program here in the US, or you need to meet the certification process if you had trained in a foreign country. So there are requirements as to who can sit for the NAPLEX. The NAPLEX itself, so again, I took the exam a few years ago. That may be the same for those of you who are tuning in or even longer. But these days it's a 6-hour exam, which is a long time. It is simultaneously very long, and also it goes by in the blink of an eye. But it is a long exam. It's 6 hours. There are scheduled breaks every 2 hours where the candidate may get up and leave and use the restroom or get a quick bite from the locker. But it's very long. It is 225 questions and they are fixed. So back in the day, the NAPLEX was, how do you say, the NAPLEX used to be adaptive, where if you got a question wrong, it then locked in on that section. These days it's fixed. The 225 questions that you get are the 225 questions that you get. And these questions are either multiple choice or multiple response, or you have to write in the answer. And it's extremely particular in terms of how you answer the question for the questions that you have to write in. They'll tell you if they want it rounded. They'll tell you if they want the question to have a decimal point or not. So all of those things go into the NAPLEX, and it can be pretty stressful in a lot of ways. It is on the computer. There's no backward navigation. So once you progress to the next question, that's it. You cannot go backwards, which also adds to some of the stress that's associated with the NAPLEX. The student can use a calculator. It's a calculator on the screen. They may not bring their own calculator into the exam or the testing facility. But the testing facility does provide a whiteboard and a marker for them to use at the desk. The NAPLEX is pass or fail. And back in the day, they would tell you your score for the NAPLEX, but these days I don't even think they tell you the score. It's just a pass or fail. If you do fail, you are allowed to repeat the exam. It would be a different exam, but you are allowed to retake the NAPLEX. But you're allowed to do that up to 5 times. And then if you're not able to pass the NAPLEX within those 5 attempts, you can no longer sit for the exam. It costs a lot of money. I'm not entirely sure what the actual price tag is. I tried to find out and to go on the NABP website, but in order for me to find out the true cost, they wanted me to sign up for the NAPLEX, and I'm not doing that again. So I don't actually know what the actual cost is right now, but it is expensive. And so for any failure, it can be a pretty significant financial strain on the student. So we certainly want to make sure that our students are passing, and ideally we want them to be passing on their first go around. It's better for everyone, financially, but also the fact that now they can practice as a pharmacist, a licensed pharmacist. So this is all just some background information about what the exam looks like these days, so that way we can have a sense of how to move forward with that information. So I told you that the NAPLEX is changing as of May 2025. So these are the new competencies. It's broken into 5 sections, and the NABP website, as you can see at the bottom, this is directly where the information is coming from. The NABP website gives us a general sense of how many questions-ish they're asking per section. Again, it's 225 questions total. So they're asking about 50 questions on foundational knowledge for pharmacy practice, 50 questions-ish for the medication use process. And they define that as prescribing, transcribing, documenting, dispensing, administering. And then the bulk of the exam, at about 80 questions, or 40% of the exam, is really focused on person-centered assessment and treatment planning. And I would argue in this section, this is the bulk of what we do as pharmacists in terms of assessing and creating plans. And I would argue that in most settings, this is the bulk of what we're doing as preceptors in our clinic sites. And then from there are 10 questions on professional practice, or 10-ish questions, and then 10-ish questions on pharmacy management and leadership. So these are the domain sections. I think it's important for us as preceptors to know this, so that way we can have a sense of, if we only have so much time and time and energy is limited, where do we want to put our focus in helping our students prioritize their studying and prioritize their learning on our rotations. The other thing to keep in mind is that within each major content domain, there are then subgroups, which I'll show you. So for example, this is the first domain, and you'll see how they break it down into further sections. And obviously we're not going to go through it all. We only have a half hour together, but you can see that pharmaceutical calculations take up a big portion of this, compounding both non-sterile and sterile, the clinical trial phases, emergency use authorizations, all of that falls into this first domain of foundational knowledge. And then, of course, talking about resources. So the students on the NAPLEX will be pretty heavily tested on, are they able to interpret the literature, primary, secondary, tertiary literature. This is how the second domain is broken down. Things like the order interpretation, so talking about drug names, classes, indications, regulations, contraindications, etc. All of these things are going to fall under the second domain. So as we are working with our students on rotation, I think it's helpful again to have a general sense of what is the NAPLEX testing, and if we are working, let's say, in an environment where we can question them on their drug names and therapeutic classes, we're helping them work on this part of the NAPLEX specifically. So same thing with domain 3. This is really broken down. And again, we're not going to go through it all, but just so you can see that we're looking at signs and symptoms, findings of medical conditions, etiology. There is a significant amount of, I don't want to say diagnosing, but the student or the candidate has to be aware of etiology of diseases, pathophys. When I took the NAPLEX, I remember being surprised by how many questions were really focused on that. I left the room thinking I took the wrong exam. I was really under the impression that it was going to be more drug focused, but I ended up with a lot of questions on pathophys and etiology. So we certainly want to make sure that our students are prepared to discuss that. And at the end of the day, now that I'm a few years out, I do recognize that we need those things, that is foundational knowledge, in order to make appropriate assessments and treatment planning. But at the time, it felt like I was really taking the wrong exam because I had quite a number of questions on pathophys and etiology. But in addition, we're going to see things, the NAPLEX is going to be testing the students to see if they can identify interactions, if they can identify omissions, errors, any sort of adverse drug reactions, etc. You'll see that they are tested on therapeutic goals, endpoints, and follow-up monitoring parameters, patient education. All of those things are going to fall under this person-centered assessment and planning domain. And remember, this is the bulk of the NAPLEX, where we're looking at about, what did we say, about 80 questions. So pretty significant. We're really going to be spending, the NAPLEX spends a lot of time on this section. Domain 4 is professional practice. So the NAPLEX spends less time on this. I think we said that it's like 10 questions, give or take a bit. But still, 10 questions are 10 questions. And these things are important with professional practice, talking about adverse drug reporting, public health initiatives, social determinants, drivers of health, ethical considerations. So these are all things certainly we can talk about on our rotations. We all, as preceptors, are in a professional practice setting, regardless of what the setting is. We're all in a professional practice setting. And so I certainly think this is a place that we can have discussions. We can talk to our students, get their take on things, get a sense of their baseline knowledge. And then if we find that there are gaps, we can then kind of talk through those and make sure that we're picking up on those gaps and that we're covering the gaps. And then lastly, this 5th domain, and again, this is all starting the NAPLEX exams in May of 2025. This last domain is talking about pharmacy management and leadership. So this is going to be kind of the day-to-day pharmacy operations that are happening, inventory, supply management, quality improvement activities, mentorship, preceptorship. So I do recognize that we're not all in settings where this may apply. I'm in primary care. I work with a myriad of providers, but I'm not really getting involved in the inventory or supply management of the office. But if I felt that the student really hasn't had a chance to talk about that on other rotations, then we certainly could find a meeting with the manager, the office manager, and talk through those things. So I recognize not every rotation is set up to have these conversations, but still, this domain is going to be tested on the NAPLEX, about 10 questions worth. So if you can have these conversations, I think that could be helpful for the student. All right, so what I'd like to do, I know we're halfway through. Now that I've giving you some background information about the NAPLEX, what it's going to look like in 2025, and how they're breaking things down into the questions. I'd like for us to practice together. It's really going to be best if either you write in the chat or feel free, of course, to unmute and join the conversation. So for the sake of this, we're going to all pretend that we're in an ambulatory care setting. That's what I do, so that's my my comfort place. So for the sake of this, that's what we're going to pretend. And I've given a very, very small case. I do recognize in real life it is a rare day when we have a patient with 3-4 meds. But I knew we only had a half hour together. So it's a very, very small patient case. We have MJ, who's 62. She mentions that she recently saw her PCP, who told her that her blood pressure is still not at goal. She complains of mild swelling in her ankles and feet. And then in terms of her past medical history, we have hypertension, hyperlipidemia, type 2 diabetes. And then you can see the medications here. We have amlodipine 10, atorvastatin 10, metformin 1000. And then the data, the objective data from today's visit, an A1C of 6.8, LDL of 120, serum creatinine of 1.2, and then a blood pressure of 152/88. So again, I know that this is not a common patient in real life, but for the sake of example, I knew we only had very limited time. So this is our patient MJ. So in terms of using this patient case to talk about the NAPLEX and to use this case to practice for the NAPLEX, step one would really be to identify the problems. So what are the clinical issues in MJ's case that you would want to talk through with a patient? What are the things that you've identified as a problem as the preceptor, as the pharmacist, and that you would want your student to be able to identify? And again, feel free to write in the chat or to speak up.
I've got A1C in the chat.
Okay. Okay, so what are the clinical issues with the A1C?
And also asking if we could see the case again.
Sure. Yep, absolutely. All right, so what are the major clinical issues for MJ?
Blood pressure.
Okay, blood pressure.
Mhm.
And what is it about these things? What is it about the blood pressure that's a clinical issue? Or what is it about the diabetes that you feel is a clinical issue?
We've got that it's too high. We also have in the chat swelling could be related to the amlodipine.
Okay. Yeah. I love it. I agree. So that's really
Oh, do we
anything.
have a weight and a BMI, Maria?
I do not. No, but we could. What are your
Yeah.
thoughts on the weight and BMI? You willing to share?
Right out of the so it's right in the chat. That was the one of the questions. But we also have blood pressure meds not optimized.
Okay.
Oh, Sarah is thinking about renal function in regard to the BMI and weight.
Okay. Yep. So those are all very fair. Those really, that's what we do as pharmacists. As step one, we try to identify the problems. So that way we can then fully assess, create a plan, etc. And so as preceptors, we're hoping that our students are able to identify the problems. And that comes back to the foundational piece of the NAPLEX where they want to make sure that students have that foundational part. So then if we were to link this to the NAPLEX competencies, what core competencies would you say are addressed in this case, or would you be linking? And again, I'll go back to the case, but which competencies do you feel are addressed in this case? And if you want me to go back to our original core competencies slide, I can also do that. So tell me what is easiest for you.
Yeah, that might be helpful, Maria.
Okay, let's do that. Close your eyes if you get a little motion sickness.
We have someone in the chat also saying pathophysiology as one of them.
Okay, pathophys, absolutely. Okay, so these are our major content domains. So in terms of our micro case, what can we link?
We've got the second domain for monitoring as well as foundational knowledge.
Okay, absolutely. Other thoughts?
Got number 3 as well, the person-centered assessment and treatment planning. We did earlier also have a comment to identify social determinants of health. So if the case was a bit expanded, we could certainly do that.
Sure. Yeah, I love it. So the real truth is, even though this is a micro case that we don't really see in real life, but even being as micro as it is, you could actually find something that hits every domain and that you could talk through every single domain. So, which I'll show you. I have them written down, or at least my thought process. Of course, I don't know if there's a right or wrong answer, but I'll show you. Well, and then I would say before we get there, before we get to my answer key, and then step 3 of what we do as pharmacists is to create an evidence-based plan. So the interventions, what would you recommend for MJ, or what would you want your student to be able to recommend for MJ? So if you want to take a quick minute and write your thoughts, what your interventions would be for MJ, and then we'll talk through my own thought process with this. So I'll go back to the case. What interventions would you do for MJ, or what you would want your student, excuse me, to do for MJ? So at this point, we've identified some problems, or at least things that would need more questions, clarifying questions. We linked to the NAPLEX, and now it's time to create a plan.
So we've got in the chat, after assessing the edema, adjust blood pressure meds by possibly lowering the amlodipine and adding an ACE inhibitor or an ARB.
Okay.
We also have writing a SOAP note, producing evidence-based suggestions.
Yeah. So I agree with all of those things. We know that blood pressure is not a goal. We know that the swelling could be contributed by or caused by the amlodipine. We could switch that out entirely, lower the dose. The LDL is not quite at goal that we would want. Blood pressure we know is not at goal. So all of those things would be part of our interventions. So I said, let's check our answers, but really this is just my own thought process and how I would link to this micro case. So in terms of hitting the first domain, which again is about 40% of the NAPLEX, I would want them to be able to identify her clinical issues, prioritize the interventions, and really have them be tailored to her conditions and goals. It's always patient-centered. It can't be a blanket recommendation. It really needs to be individualized. We would talk through the benefits and risks of the therapy changes. To hit the second domain, we could talk about evaluating the current effectiveness, the current therapy effectiveness. We could propose medication adjustments, additions, monitor potential side effects. All of those things fall under that second domain, which again is worth about 25%. To hit domain 3, foundational knowledge, we can apply evidence-based principles to optimize med therapy, interpret lab values. That's going to be a major part of the NAPLEX. The NAPLEX usually gives case-based questions, and the student really has, or the graduate really has to be able to interpret lab values in order to make the assessment. Understand the role of lifestyle interventions. And then from there to hit domain 4, we can do professional practice. We can talk about how the student would educate MJ on the medication changes. We can make sure that the recommendations are truly aligned with evidence-based guidelines, best practices, etc. And then to hit domain 5, we could talk about how we would discuss this with an interprofessional team. We could talk about how we would do these medication changes in the workflow. What sort of process would it be within the computer system or the EHR? We could also model leadership by prioritizing tasks, advocating for patient-centered care. All of this really falls under pharmacy management and leadership. We can talk about documentation, how much documentation matters, and that the documentation needs to be succinct and professional and appropriate, evidence-based, etc., and how all of that matters for quality improvement. And that falls under pharmacy management as well. So even though, again, it's such a small case, we really can hit every domain of the NAPLEX and make sure that we're getting practice in all of those. So I know we're just about out of time, but I wanted to leave a couple of minutes for you to be able to share your thoughts if you have had success in doing things like this, if this is something that you've done before on rotations. I'd love to hear your thoughts again if you write them in the chat, or feel free to unmute and share your thoughts.
Hey, Maria, and thank you for this great presentation. If someone wanted to see some sample NAPLEX questions, is that available somewhere?
So the NABP website itself, thank you for the question, by the way. The NABP website offers it offers sample questions for every type of question. And so there's, we said in the beginning, there's multiple choice, there's open response, there's a multi-select. So the NABP website does have examples for each type. But if you want more examples than that, our students at Western New England have access to UWorld. And so because you precept our students, you also have access to UWorld through the students. So you can ask the students to create a UWorld quiz, either a random UWorld quiz or a UWorld quiz that's focused, let's say, just on diabetes or just on cardiology or infectious disease, etc. And then you and the students together can work through to see how the questions are worded. And I found that the UWorld resource that we use is pretty similar to the NAPLEX itself. So I have found that to be helpful. And again, the students have access to that, so we have access to it through the students. But the NABP website itself, you can also find some questions as well. Did that answer your question, Melissa?
Yes, perfectly. I'm thinking we should post a few too. Maybe we have a resources tab in core. Maybe we should post a sample.
Sure.
Might be nice.
Sure, absolutely. Thank you for the question. Other questions, other thoughts? Anything you've done that you've found to be really helpful and you want to share with the group? That would also be great to hear. Okay. Well, if there is anything and you'd like to continue the conversation, please feel free to reach out. My name is Maria Charbonneau, and my email is my full name with a period in between, so maria.charbonneau@wne.edu. And I'm happy to continue the conversation to answer any questions that you may have. Thank you again for being here and listening. I appreciate it.
Maria, thank you so much for presenting today, and I want to thank all of you for joining us. This will be shared on CORE, and with that, Dom will also put out Maria's contact information. So if you have questions or thoughts, always feel free to reach out to her. She is a wealth of knowledge. So thank you so much, Maria, for presenting today.
Thank you. Enjoy your day.
We hope you all have a wonderful day and happy holidays.
Take care, everybody.